Hi, my name is Amar Singh. I'm the founder and CEO of Clove Dental, sitting here in New Delhi, which is where our headquarters is. We had set a vision that by financial year 2021, we will have 600 clinics across India. And we are fortunate, with the help of our patients and our doctors and our teams, we have, on January 28th, we launched our 300th clinic. Which makes us not only the largest dental chain in India, but also the largest employer of dentists in the country. Armed Forces was previously the largest employer. We just surpassed that. With 300 clinics, we have about 120 in Delhi NCR. We have about 50 in Bangalore, 40 in Hyderabad, about 30 in Chennai, and the rest of them across other cities of India. And we are adding anywhere between 8 to 10 new clinics every month on our way to 600.
Tell something about the milestones in the day of inception to today.
Right. So in terms of milestones, when we started the company in 2011, we opened one clinic. Then in 2012, we opened 3 more. Then a year later, we had 12. Then we had 27. The following year, we had 60, 104, and so on and so forth. So I think every year we have grown in terms of the number of clinics we've opened, in the number of patients we have treated, in the number of cities we have entered. And we have over 600,000 unique patients who have been part of Clove. We have treated maybe over 1.5 million treatments that we have done over the last few years. So continues to be growth. So quality in healthcare is absolutely critical and absolutely important. At Clove, that's one of our core values. And quality begins at every aspect of the organization. So the first thing, of course, is the kind of doctors and the kind of employees that you bring on board. They have to be high quality, high caliber. So in fact, 70% of our dentists have advanced degrees with specializations, MDSs. So we bring on the highest quality caliber dentists. That's number one. The second thing is that you have to make sure that your teams are incentivized in the right fashion. So all our doctors are on salary, and this allows them to focus on patient care first, and patient satisfaction becomes a key element. And the third thing, of course, is that you have to monitor on an ongoing basis. So every clinic is audited twice a month to make sure that we are following, every clinic across the country is following those healthcare protocols that are so critical. For example, sterilization protocols or hygiene or waste management or clinical protocols and so forth. I think the change in attitude and mindset is happening. Our patients every day, more and more, are appreciating the quality that we offer, the kind of care that we offer. So I think patient mindset is changing. Information is available to almost everybody. Almost every Indian I see around has a smartphone or a version of a smartphone. So they have access to information. So they have access to what is good in healthcare, what they should expect from a healthcare giver, a healthcare provider. So therefore, I think that mindset is changing. And for Clove, the fact that we are able to offer those best practices to our patients actually helps in that learning process. Right. One of the most critical aspects or challenges of dentistry is patient awareness and patient education, or consumer awareness and consumer education. So we are constantly working with our PR, with our doctors, with our society, with our community to bring awareness around oral hygiene, oral health, and the role of a dentist. That's the number one aspect. The second aspect, of course, is to make sure that our infrastructure that's available, the clinics that are available, are following highest quality standards, particularly when it comes to hygiene and sterilization. Because in dentistry, it is very common that if you are using unsterilized or improperly sterilized instruments or tools, you can pass on infection from one patient to the other. So therefore, it becomes very critical that the highest quality of hygiene and sterilizations are followed. And the third thing is to make sure that you are keeping your pricing and your interactions with patients consistent. So we have standardized pricing for all our treatments so that our consumers are not stressing out that the charges that they're being charged are fair or not. So those are the things that I think are important and critical in dentistry. Right, so oral care is absolutely critical. Oral health is absolutely critical. You know, imagine we live and for living we need to eat, and we use our mouth to eat. So that is your entire gateway into your entire body, your mouth and your nose really. So therefore oral care becomes very important, and often, unfortunately, in India, the incidence rates of tobacco chewers, smokers, betel nut chewers, or gutka takers is pretty high, and which makes the rate of oral cancer very high in India. I think 1 in every 3 or 4 cancers are oral cancers. So it's a significant epidemic that's happening. The best thing the patients or people who are using those products, they can do is to actually visit a dentist regularly, because a dentist can identify much earlier any early symptoms of any disease that could lead into oral cancer. So therefore visiting a dentist actually is a much smarter preventive mechanism.